Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Have you ever heard of spinal stenosis? It's a long word and you may not have heard of it, but it is a big deal. So you're going to want to stay tuned because we're going to talk about it and tell you exactly what it is and how it works next. If you've ever had back pain, there's a lot of reasons that can happen, whether it's in your neck or in your lower back, even in your middle back. One of the reasons is a condition called spinal stenosis. It's important that you know about it because if you have this condition, it's not just easily treatable like some of the other reasons for spinal pain. So I'm going to show you a spine and we're going to talk about what you see with spinal stenosis. So this is your spine from the front. This is it from the side. The spinal cord runs all the way down through the spine, all the way down the back, and then the nerves come out through the holes called vertebral foramen. So we have our spinal canal where the spinal cord comes through, and the vertebral foramen where the individual nerves come out. The reason that anatomy is important for you is because spinal stenosis is a shrinking of either the spinal canal in one place or another, or the holes, the foramen, where the vertebra exit. Either way, if that hole gets smaller from either degeneration, as in the osteoarthritis creates the hole smaller because the vertebra shrink closer together, the disc gets smaller. So if you can see where a disc is going to get smaller, the hole is going to get smaller too. Now, when these holes around the spine are normal, there's a certain amount of space where the nerve is taking up some part of the space, and then blood vessels, arteries, and nerves, these kind of things take up part of space. And then there's meant to be a gap in space so that none of this stuff gets squished. Well, if you do have degeneration where these things go down, then you can see how that hole is going to shrink as well. So now those same structures that had space once don't have space anymore. The same thing can happen in the spinal cord. That would be called central canal stenosis. And that is going to be where the whole cord or the whole spinal canal at one level or another throughout this system is going to shrink. And when it does, then it can hit the entire spinal cord or just part of it, depending where the pressure gets put. Now, the reason this is so important is when that hole shrinks and you pinch that nerve, you're going to get pain, but oftentimes that pain is going to radiate, also called radiculitis or radiculopathy, where it's going to go down an arm, down a leg, it can go into your head, into your neck. All of these things can be really, really painful. So what do you do with spinal stenosis? Well, it depends on the severity. It can go anywhere from therapy, management, injections, pain medications, meditation, all these things on the lower end can help a mild case of spinal stenosis. But when it gets to a significant amount, there's literally surgeries that they do to free up space in the spinal canal or around the foramen. So that's a little bit about spinal stenosis. I hope it's been helpful. If it has, please share it with someone who is having back pain or has been told they have spinal stenosis. Maybe it'll give them a little more insight along with the information they already have. And of course, if you have any questions, you can reach out to me, jim@ramoslaw.com, and I'll help you in any way that I can. And also, if there's other things that you would like to talk about, topics that you'd like to see shared, please let me know. Until next time, remember, your health matters.